The team finished their interviews at Dr. Wong's office. They were provided a nice lunch and then traveled to another area of Kuala Lumpur to interview Dr. Kenny Yong, who focuses on detoxification. We'll go to that interview now.
Yeah. Tell me about detoxification. You mentioned, the toxic body, inside and out. Is detoxification a part of your cancer treatment regime that you practice here?
Yes, big time, because when a patient comes to us, usually they are already jammed. Cancer is actually already a toxified body. A person with cancer is already toxic. Okay, so immediately if we put a lot of drugs inside them, it's not going to work because they are already toxified, because of the speed of detoxification is slow. And then the speed of intoxication is fast without them knowing. So the liver is the major organ that do detoxification. Liver is a kitchen and also a toilet together, 2 in 1. Okay, because when you eat food, the liver produces food to pass into the blood. And then if the cell give rubbish to the blood will pass it to the liver, and then the liver say, I am the toilet, give it back to me, I will excrete it. So the liver will actually take all these fat-soluble toxins into the gall. So from the gall, they are looking for fiber in the gut, because the gall will squeeze the juice into the gut, and from the gut we need these fibers, and then we need all these healthy bacteria from the gut, and then not just excreted into the gut, but not reabsorbed at the back. So detoxification needs a lot of science to understand the rectum, the area of the rectum, and then the coffee enema, water enema, ozone water enema, even Helixor, mistletoe enema. Well, if you study enema is the key major roles that we teach a lot of patients to do enema properly. The water retention and the water non-retention enema, the coffee retention therapeutic enema, and then if you study enema, there are more than 200 over types of enema. They are divided into retention enema and non-retention enema, and then there is also special items enema like B complexes. You can do that.
You mentioned mistletoe?
Yeah, mistletoe. You can even dilute mistletoe, and we have done that also if we have a rectal tumor and this and that, and we usually do a checkup.
Is that Iscador that you use?
We use Helixor. Helixor is the non-fermented one. Iscador is a fermented one. Helixor is more pure, so that you can do IV, you can do intratumoral injection. If you dilute the Iscador, it has no problem. If you dilute it, you can retain it, and if the tumor can be soaked and sort of swim inside these solutions, it can shrink as well. The science is to get this mistletoe or these medications in contact with the tumors in the rectum, and then from the rectum, the portal veins is able to release. If it's a coffee enema, there is this enzyme, the 4 very special enzyme, will go into the liver and increase the GST, the glutathione S transferase. That would really help the liver to detox the next 24 to 48 hours.
Liver detox is so important. Thank you, Dr. Kenny. It was a busy day for the crew. After leaving Dr. Kenny's office,